Hi everyone, my name is Ashley Dorsey and I am re-recording my video on this week's assignment on dealing with tough APRN focus interview questions. So the questions that I chose are the first one. What would you do if you disagreed with the care provided by your overseeing physician? As a registered nurse, I have always been an advocate for my patients' health, safety, and well-being. If I disagreed with the care provided by my overseeing physician, I would intervene by pulling the physician aside and respectfully explain why I disagree with the care being provided. I would make suggestions on what should be done or changed. I would also remind the physician the importance of patient safety and why the right plan to meet the healthcare needs is needed for this patient. Have you ever been in disagreement with a physician over the diagnosis or treatment of a patient? How did you handle the situation? I once disagreed with a physician who wanted to continue to increase Pitocin against protocol on a laboring patient I was caring for. The fetal monitor showed the fetal heart rate was slightly decreasing or having decelerations after a few contractions. I intervened and stopped the Pitocin infusion and continued monitoring the patient's contractions and the fetal response to the contractions. The physician entered the room to assess the patient and started yelling at me because I had stopped the Pitocin, and his patient was not progressing as he felt she should. I pulled the physician aside and showed him the fetal strip with the fetal heart rate dropping after each contraction. After reviewing the fetal strip himself and seeing what I meant, the physician reluctantly agreed to not continue with the Pitocin and ordered me to continue monitoring the patient. Shortly after, we ended up in an urgent C-section in which the physician later apologized for his prior actions. So question number 2, how will you respond when a patient tells you they cannot afford the treatments you are suggesting they need? If a patient responds to me that they cannot afford the treatments that I suggested for them, I would respond by further inquiring of the patient's concern of payment. If the treatment suggested is indeed a financial burden on the patient, I would reevaluate the plan of care to see what alternatives can be made. I would check to see if the required treatment could be obtained through a local health clinic or a charitable hospital that would help reduce or alleviate out-of-pocket costs to the patient. I would also research to see if there is another similar yet less costly effective treatment or less costly treatment option available that the patient will agree upon without compromising the patient's health or treatment regimen. Question number 3. What would you do if a patient is yelling at you in your office because of any of the following? They are not responding positively to pain medication and request more than the allowable amount. I would try to de-escalate the situation by calmly explaining to the patient more than the allowable amount of pain medication cannot and will not be authorized. I will re-review the patient's current pain management regimen and discuss with the patient some non-pharmacological methods that can be used for their pain control, such as alternating heat and cold compresses, relaxation techniques that can help with the management of their pain. I will refer to physical therapy if they have not already done so, and I would also consider with them or suggest chiropractic care that could be effective in managing their pain if they are up to it. Question number 4. Let's assume that you are caring for a female patient. It is your understanding that she comes from a culture wherein a patient's husband often speaks for the patient regarding all care. During a visit, how do you address the patient? What would you do if the patient does not speak at all? What if the patient fails to show typical patterns of behavior demonstrating her knowledge or consent? Understanding and respecting a person's culture is essential. I would introduce myself to both the patient and her husband, as I would do with all my patients. And I will begin by listening to what the husband has to say regarding his wife's care. While noticing the patient remains silent during our interaction, I will continue to explain the assessment process and the treatment plan in detail while continuing to address the patient. I would express the importance of the patient's involvement in her own healthcare decisions to ensure her safety, understanding, and proper treatment. If the patient shows a failure of understanding or knowledge for her consent of treatment, I would again explain the procedure cannot be done without her knowledge and consent to ensure that an informed decision on her part would be made for the procedure and treatment that she needs. If my efforts continue to fail and the female patient continues to remain silent and not acknowledge her understanding of what is going on or what is being requested, then I will consult with my overseeing physician for advice. And if that doesn't work, then I would look into seeing if there's any ethics point of contact within our health clinic or within the local hospital or clinic that can step in and help me with this decision and try to get the patient to understand the importance of her input in her own care. Thank you for reviewing my video, and I look forward to hearing back some of your feedback on my video response. Thanks, guys. Bye.